Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Uyen Lee. Uyen Lee is a staff nurse for the Washington Hospital Healthcare System.
Hi, good evening. Thank you for coming tonight. My name is Uyen. A little something about myself. I work at Washington Hospital for about 19 years. I work on a surgical floor where we take care of all kinds of surgical patients. And I also cross-trained in wound for about four or 5 years. And today I'm going to talk about diabetes, complications, and amputations preventions. So what is diabetes? Diabetes is metabolic disease that causes high blood sugar. The hormone insulin that moves the sugar from the blood into your cells to be stored or used for the energy. With diabetes, your body neither doesn't make enough insulin or can use the insulin effectively. Untreated high blood sugar from diabetes can cause damage to your nerves, eyes, kidneys, and other organs. There are different types of diabetes. Type 1 is an autoimmune disease where your immune system basically attacks your own pancreas. The pancreas is an organ in your body that produces insulin because of the immune system attacking it. So the pancreas cannot produce or very low level of insulin being produced. Type 2 diabetes occurs when your body becomes resistant to the insulin. So that causes the sugar to build up in your bloodstream. Gestational diabetes is a high blood sugar during pregnancy. Insulin-blocking hormones are produced by the placenta causes this type of diabetes. And if you have gestational diabetes, chances for you to become a type 2 diabetes increase as you get older. Pre-diabetes occurs when your blood sugar is higher than normal, but it's not high enough to be diagnosed as type 2 diabetes. So, of course, increase in thirst, hunger, and frequent urination, and usually the urine has that fruity smell. Extreme fatigue because your body don't have any energy. All the sugar has been in the bloodstream, not in the cells, so the cells are practically starving. Sores that don't heal, and blurry vision. So what are the risk factors? Type 1. Unfortunately, for type 1 is genetic, so there's not much you can do about that. For type 2, your risk increases with weight, overweight, if you're 45 or older, or if you have a parent or sibling with the condition, you aren't physically active. And of course, for a woman, we have gestational diabetes, pre-diabetics, and of course, high blood pressure, high cholesterol, or high triglyceride. And of course, if you're also your descendant as well, African American, Hispanic, Latino, Alaska, Native, Pacific Islander, American or Asian descendant, that we are at high risk for diabetes. So, treatments and prevention. What can we do with type 1 diabetes? Since your body cannot make the insulin, so we just have to supplement with insulin. For type 2, we can diet, exercise, and we can take oral medications and or insulin to help control blood sugar. So how can we prevent it? Unfortunately, for type 1, it's not preventable. But for type 2, Some factors are not preventable, such as age or genes, but diet and exercise is something that we can do. Control our blood pressure, control our cholesterol level. There's just a few things that we can do to help with a type 2 diabetes. So the normal blood sugar range, 70 to 130 before meal, less than 180 2 hours after meal. We can help with the less than 180 before after meal, 2 hours after meal by walking. Just a short 15 minutes walk after meal will help really lower the blood sugar in the bloodstream. What are the complications? The longer you live with diabetes, the greater risk of your complications in terms of damaging to the organ, particularly the eyes, the kidney, because the eye and kidney are dependent on the small blood vessels to supply them with food and nutrient. So with diabetes, your blood vessel become hardened and narrow over time. Because of that, it's greatly affect the kidney and the vision, the eyes. Heart disease, heart attack, and stroke, again, because over time, the blood vessel become hardened and narrow, so create more risk for heart attack. Neuropathy. Neuropathy is a nerve damage where you cannot feel your feet, or your feet will feel numb and tingling and weakness to your feet. Sores that don't heal, or over time, the sore will cause you to have foot or even leg amputation. Peripheral artery disease, or PAD. Again, the diabetes causes the blood vessels to harden and narrow. And one of the good examples is like you're having calf pains when you're walking uphill, walking fast, or walking a hard surface. Unfortunately, you still have to exercise, you still have to walk to help improve circulation. If you guys are smoking, anybody in here smokes? No? Very good. And if you know somebody who smokes, I mean, encourage them to stop smoking because smoking will aggravate. Diabetes in your feet. Foot complications such as peripheral neuropathy and circulation problems can make it difficult for the wounds to heal. Peripheral neuropathy is a form of peripheral nerve damage that can cause, again, numbness, tingling, or weakness. Because of those nerve damage, you can't feel pain, and inadvertently you have injury without realizing that you have an injury to your foot. And the wound can go on for days without you realizing it, and the treatment might come too late. Diabetes is one of the leading causes of the lower extremity amputation in the United States. So what can we do to help? Stay active, keep your blood sugar under control, and inspect your feet every day. Before you go to bed, after you shower, just set a time, a minute or two every day to look at your feet every day. If you have a hard time bending over, use a mirror or ask the spouse or whoever in your household to look at your feet every day for you. It's very important. So what you look for when you look at your feet: calluses or corns, sores, cuts, any red or swollen spots on your feet, hot spot on the area that are warm to touch, change in skin color, anything different from what you've noticed from yesterday, ingrown or overgrown toenails, dry or cracked skin. Usually the dry or cracked skin is a perfect little crevices for the bacteria to harbor the bacteria. And your podiatrist is your best friend. If you have a hard time and you're not confident about cutting your toenails, then definitely go to a podiatrist to cut your toenails. So as you can see, those blisters on the bottom of the foot there, or the feet there, and those calluses, Those are caused by not wearing a proper fitting shoes. So shoes are also very important as well. And this is an example of a corn and ingrown toenails. This one is a fungal infections. If you notice between the web of your toes, those areas tends to be moist. So when you do moisturize your feet, don't put any lotions or anything in between those web of the toes. So anything that's moist, wet, warm, and dark, the fungal love that. So this is an example of a minor injury that can be avoided by wearing shoes at all time. As a diabetic, never go barefoot. As for the ladies, no more thongs. I mean those flip-flops. Because the flip-flops gonna cause frictions in between the web of the feet, and that can cause a wound. Shoes at all time, closed-toe shoes at all time, so that prevent any kind of injury. Because that tiny little injury can become this. I mean, it's not the same foot, but you get the idea. If you look at the inside, that foot there, that's probably bone infections, and the tissues are all probably mushed up already. That need to be amputated. There's no salvaging in that. And of course, it's the infection, it smells really bad. Bacteria love sugar. If you don't control your blood sugar, they just thrive in a sugar environment. And they set up housing, and they won't go away. And the wound won't heal unless it's the optimal conditions, such as plenty of oxygen, plenty of nutrient. If those conditions are not met, the wound won't heal. And there's some wound can last long as years, months. I have a coworker, his mom had a wound for about 2.5 to 3 months before it healed. And that's because he diligently took care of it. That just tells you how long it takes for sometimes even years for a wound to heal, if it's healed. We sometimes have a same patient coming in for years and same problem. And of course, when you have a wound, a sore on your feet, we walk on them all the time. So we always put pressure on them. So it's very difficult for your feet to heal without always being pressed on. And the reason I put these pictures on there because that is infected and gangrene toes. I remember the first time when I opened the dressing and the toe fell off. I was telling myself, don't scream. So my thought was, oh my God, don't scream, don't scream. I just smile and then wrap it back up. And I tell my preceptor, can you open that up again? I'm just gonna step outside for a moment. But that's why I put it in there. But she didn't tell me what I was getting myself into when I told her I wanted to be trained as a wound nurse. But anyhow, so those toes are all infected all the way to the bone, and pretty much no saving there. So that whole foot is gone. And we don't want this. We don't want it to become like this. Because we want her to walk again without, help. And it's very debilitating when it comes to that stage. So the best treatment for diabetic ulcer is to prevent it in the first place, to prevent it from happening. I won't go into detail on how to treat a wound because that's another 5 more sessions. But my goal here is to tell you guys how to prevent, how to care for your foot before that happens. So what can we do with preventive care? Keep your blood sugar within target range. Get your spouse walking with you, your dog, your loved one, whoever. My daughter took my caterpillar for a walk one time. said, I'm taking my caterpillar for a walk. I was like, okay. So improve blood circulation to your feet by, again, walking. Even though if you have PAD or peripheral artery disease, that will cause pain if you walk on a hard surface. That's why wear shoes or walking uphill. But even then, you still should walk because walking will help us to improve circulation, get things moving. Okay, so exercise regularly. Use comfortable, sturdy, closed-toe shoes to protect your feet. Diet, eat a balanced diet, and that's another whole entire different subject by itself. Have a touch sensation test yearly and have your feet inspected with each doctor visit. And if the doctor do not look at your feet, tell them, I washed my feet this morning. Please inspect my feet. Because it's very important. At least they know, they have an idea what your feet look like, and over time they get used to it and they can notice a change, a difference. Be proactive, because you're the one that take care of yourself best. That's what I tell my kids. So healthy feet are happy feet. Check your feet every day, including between your toes. Use a mirror if you don't have anybody to help you. Take a picture of it if you want a reference the next day or the following day. If something you look, oh, this is kind of weird, I don't see this before, take a picture. Show it to your doctor. See your doctor for any abnormality, so please go see your doctor for that wound. Do not go barefoot, even around the house. You never know what's on the floor, and you cannot feel your feet anymore. You cannot feel pain. You have numbness, you have tingling, you cannot feel anything. So you step on something without realizing you step on that little toy, that Lego toy that your kids left out. Do not smoke. Keep your feet clean and dry. Do not soak them, but you can wash them with warm water. Pat dry and moisturize with lotions or Aquaphor or vitamin A and D. I like vitamin A and D. It's really good. And it's very cheap, only a few dollars. Ladder on your feet? Yes. Yeah. But it does feel good though, especially if your dry feet and it's itchy and it's dry and itchy. You just want to soak them to calm the itchiness. But no, don't do that. Just clean them well, pat dry, and then moisturize them with vitamin A and D. But not between the web of the toes. I mean, it helps. It's really help. If you do consistently every day, you can tell the difference. Avoid hot water. Test your water with your hands, not your feet. Trim the nails straight across and smooth the soft nail file. Do not cut the cuticles. And if you're uncomfortable about cutting your nails, then go see your podiatrist. They can offer that service for you. And if something happened, you can blame it on them. Use a pumice stone to keep the calluses in check. Please don't try to cut the calluses of the corn yourself or use chemical that's over the counter on them because you don't want to cause any problem. Again, see a podiatrist. Wear proper fitting shoes and check inside the shoes before you wear them. This is very important that you do this. There is a gentleman who is a young gentleman, diabetic for a while. He left his shoes outside in the backyard and he went out just to do garden work. And he didn't check the shoes and there was a spider in it. So he got a spider bitten by a spider. And unfortunately, it got infected and eventually he got a below the knee amputation. And he was very good at inspecting his shoes, inspecting his feet, really keep an eye on his blood sugar, but it's just a matter of one incident that can cause all those problems. There's this very sweet gentleman who went to the office, and he's older. He went to the office and he said, I don't know how I get this wound. It was on the side of the foot. It would just make absolutely no sense. Usually it's on the bottom of the foot. I don't know how I get this wound. He just shaking his head, and then after talking for a little bit, he said, you know what? I cannot find my hearing aid. I don't know where it is. So we looked inside the shoe. It was in the shoes. Because he couldn't feel anything, had neuropathy, so he couldn't feel any pain. So we got know how or when or how long the hearing aid was in the shoes. So look inside the shoe before you wear them. And for the ladies, sorry, if you can avoid the high heels and pointed shoes, they're best. They're really bad for your feet. I don't wear high heels anymore. I stopped wearing high heels. And those pointed shoes, even though they're very cute, but sorry. Wear white natural fiber socks, such as an easy to breathe like cotton or wool. Why do we have to wear white socks? White socks cannot hide anything. So let's say if you have an injury to your foot and you don't inspect your feet, and then you don't realize you have an injury. You walk around and somebody, your friend, will say, hey, there's blood on your socks. What happened? So the white sock will not, the black sock will hide that, but the white sock won't. And that's how my coworker found out that his mom has an injury. Because he said, Mom, what happened to your foot? How come there's blood on your socks? And she didn't even realize she had that wound. Luckily, it healed up, but it took 2 to 3 months. So it takes a long time. And normally for a cut or a scrape, on a perfect optimal condition, it takes about a week to a week and a half for it to heal. On a young, with no other conditions. But for diabetics, we have poor circulation, we have neuropathy, we don't feel no pain, so we're still gonna walk on the wound, walk on the sore. High blood sugar, the bacteria takes over. So there's no lack of nutrient and bacteria taking over. It's create a perfect storm for the wound won't heal. And then it can take months or years. And sometimes you get frustrated, and then I've seen patients who are so frustrated they just give up. They say, I don't want to do this no more. So the best way to treat a wound, a diabetic sore, is to prevent it in the first place. So if you don't get anything from my presentation today, at least daily inspection of your feet is very essential. And that's a beautiful pair of feet.